Hey there, it's Dr. Jim. Thank you for stopping by. My topic today, the psychology of obesity. And this is just a brief introduction to the topic because we could go on and on and on about this particular topic. There's a lot of information out there on it. Some researchers believe that there's a relationship between mental health, emotional health, and obesity. And they do admit that this is a very complex topic. When you take mental and emotional health and obesity and look at the relationships, the associations between the two, very complicated. There are also those who find no clear association whatsoever between mental health and weight. And it's true that most obese people do not qualify for a psychiatric diagnosis at all. To this day, the American Psychiatric Association has not regarded overeating or excess weight as a psychiatric disorder, besides binge eating disorder, which was just added in the DSM-5. So this does end up being a truly complicated topic. So what exactly qualifies as obese? If the body mass index, or the BMI, is used as a frame of reference, then having a very high amount of body fat in relation to lean body mass, or BMI, of 30 or higher is considered obese according to the CDC. Some experts argue that the BMI is outdated. And although I'm not an expert per se in body mass index, I do believe it is outdated. Why? It's been used for over 100 years, and it simply doesn't accurately measure body composition. Technically, the BMI is a measure of a person's weight in relation to his or her height, specifically their weight in kilograms divided by the square of his or her height in meters. So, I mean, that's a really, really simple formula to calculate body composition. According to the CDC, 40% of Americans are considered obese, which means that 70 million, 35 million men, 35 million women are obese in the United States. Another 100 million Americans are considered overweight, but not obese. These numbers, when added up, make up roughly half of the nation's population. Each year, almost 300,000 deaths are due to obesity-related conditions like heart disease, stroke, certain cancers, and type 2 diabetes. Over 15% of American children are obese, and the rate of type 2 diabetes is on the rise as a result. Hundreds of billions of dollars are spent annually to treat obesity-related disorders and conditions. So what is the psychology-obesity connection? Some studies show that people who are depressed are more likely to develop a metabolic syndrome like insulin resistance, high blood pressure, excess abdominal fat, and high cholesterol that often accompanies excess weight, especially when it's deposited around the waist. Studies show that foods high in fat, sugar, and calories lower the body's response to chronic stress. Some individuals may eat more during times of stress, and they might use their food as comfort when they're sad, lonely, angry, or when they are suffering from low self-esteem. So this is a very complex relationship. The relationship between obesity and emotions is further complicated by the fact that obesity can lead to poor health, which in turn can negatively impact one's mental and emotional well-being. It's sort of like this cyclical relationship. Poor health is associated with depression and anxiety, for instance. Overweight people are more likely to lose the psychological benefits gained from exercising. Social stigma and weight discrimination can further cause stress, anxiety, depression. These problems may be more severe when the individual feels out of control with their eating behaviors and start to engage in self-blame and self-hatred. So here's my takeaway from this very complicated topic. The relationship between mental health and obesity may very well be a which comes first, the chicken or the egg type of deal, and it appears to be cyclical. While researchers cannot agree whether there is a direct relationship between psychology and weight, there does indeed seem to be a few things that make sense, such as mood and eating behavior. Those do seem to be connected. Time and more research are definitely needed to make this topic less complicated and more simply understood. Thanks for spending some time with me. I'm Dr. Jim. This has been my take on psychology of obesity, a brief introduction. Take care, like my channel, subscribe to my channel, share this with friends and colleagues. Take care.